Now to check in with News Channel 5's medical specialist, Dr. David Soria. He is here to answer some of your health questions. When he's not here with us, he is the Chief of Emergency Medicine at Wellington Regional Medical Center. Welcome back.
How are you?
Nice to see you today.
Good to see you.
Doing well, doing well. Our first question for you today, tied to our chilly weather, I guess we could say. This viewer wants to know, what's the best way to treat dry skin?
Yeah, well, it's definitely that time of year. You know, lower humidity, lower temperatures equals dry skin. I mean, I remember being up north. It was really a problem. So, bottom line is, the good news is that because it's caused by external factors, it can be treated very well with external therapy. So what do you want to do? Well, here's a couple of strategies. Number one, no long hot showers. That hot water strips your skin of the oil. Yeah, I know it feels great, but you are going to come out with dry skin. Use a gentle cleanser, something with a moisturizer in it, and within about 5 minutes of getting out, make sure you apply the moisturizer, because it actually retains the moisture in your skin. Now, in the moisturizer, there's a couple of things I want you to remember as far as the ingredients. Make sure you look for one with a ceramide in it, dimethicone, hyaluronic acid, or lanolin. Okay, those are very key ingredients.
You want those in the lotion?
In the moisturizer, all of which help the skin retain its moisture. And the good news is you don't have to go to a high-end department store. You can find those right down the street at any local drugstore in any of the less expensive moisturizers.
It all works the same. You don't have to spend $50 on special lotion. Good advice. Our next question for you, how common is psoriasis, and what's the best way to treat that?
Yeah, psoriasis is very common. It's actually one of the most common skin diseases in the world. About 125 million people have it worldwide, 7 million right here in the U.S., which represents about 2.5% of our population, so not insignificant. What it is a scaly plaque that grows on the surface of the skin.
Different than just dry skin.
Very, very different, because this is actually a disease that comes from inside. It's a hyperproduction of the skin cells, and it causes raised plaques on a red, itchy patch. So that can be problematic, because it can occur anywhere throughout the body. So how do you treat it? There's two things that we aim for when we treat it, because there is no cure. One, to decrease the production of the skin cells, and the other, to remove the scaly plaques. So you want to use vitamin D's, topical steroids, anthralin, retinoic acid, all work to decrease the production of skin cells. And then, of course, coal tar, salicylic acids actually help remove some of the skin from the surface of your skin. Bottom line, though, is that different psoriasis requires different treatment, and everybody's different. So if you have it, absolutely make sure you see your doctor.
See your doctor on that one. All right. Thank you as always. Thanks for stopping by. And if you have a question for Dr. David Soria, you can get it to him through us, through our website at WBTV.com. Just click on the health link. You'll see it there right on the right-hand side if you'd like to send him a question. We'll see you next week, and we'll see you right after the break.